I didn't have any risk factors. I didn't have any family history of strokes or heart attacks.
I had no history of heart failure in my family.
They were like, how are you 30 years old having a heart attack?
For me at that time, I was only 29 years old. The least thing in my mind was having an issue with heart health.
I think there's a misconception that it's only older people that get heart disease.
That's something that we kind of think of as a man's disease.
Like, why would this happen to me? Like, of all people, you know?
Even though I knew that heart disease was in my future, I was thinking heart disease was 20 years in my future.
I initially thought that it was a panic attack because I didn't know.
It did not occur to me in the slightest that I would have heart failure or a stroke.
I wasn't educated on the signs and symptoms.
I don't think I took those measures early enough because I thought it was an old person's disease.
And now I sit with a dead part in my brain because I had a stroke and I had heart failure right after I gave birth to my daughter.
I just want young women to, yes, be ambitious, go after your goals, but focus on your health.
I remember speaking to my husband in ICU and I told him, my life will change. My life is going to change for the better. And I have done that. You can do anything you put your heart and mind to, and I am living proof of that.
We are strong. We can do it. We know we can do it. I'm just ready to take on the world. That's how I feel now. That's what it did. If anything, having a heart attack made me that much stronger.
The women you just saw are our Go Red for Women, Real Women, an incredible group of survivors who share their stories to help raise awareness of cardiovascular disease among women, ensuring every woman knows their greatest health threat. It's true what they say, knowledge is power. But what happens when there are gaps in knowledge? When it comes to heart disease and stroke, women are losing their lives. In fact, 1 in 3 women will die from cardiovascular disease. That must change now. So how do we combat this? We combat it with knowledge. First, we need the science. Women have historically been underrepresented in research, but it's more than that. At one point, they were actually excluded from participating in research. In 1993, less than 30 years ago, it took an act of Congress to mandate the inclusion of women in research. The fact is, men and women are biologically different. We know that men and women have different symptoms. We know that women have unique risk factors. We know that women experience pregnancy and menopause, which can impact their cardiovascular health, both at that time and in the long term. We need more research specifically for women, research to help us unlock new knowledge to better prevent incidents, diagnose, and to treat women. We need the knowledge and the science behind it. Secondly, we need each of you. We need you to join us. Women are incredible, and together we are unstoppable. It's time for us to raise our hands and say, I won't let one more woman be lost to cardiovascular disease. I will ensure women are represented in science and research, and I can make a difference. Join us, learn more about Research Goes Red and how you can help us unlock the knowledge to save lives. Research Goes Red puts women like you in the driver's seat. It gives you the opportunity to participate in life-saving research. You don't even have to go anywhere. The online platform makes it easy for you to be part of the latest science. Through Research Goes Red, you have the chance to make an incredible, lasting impact on women's health. Join us today, help drive research, innovation, and knowledge so that together we can save more women's lives. Today, I am joined by some incredible speakers who are going to share with us more about Research Goes Red, the very latest in science, and of course, we're going to have fun along the way. Now, please join me in welcoming cardiologist and CBS News senior medical correspondent, Dr. Tara Narula, along with our special guest, actress, director, author, and American Heart Association national volunteer, Elizabeth Röhm.
Hi, Nancy and Elizabeth. Thank you so much, Nancy, for that introduction. I'm Dr. Tara Narula, and in today's Heart to Heart, I am joined by our special guest, Elizabeth Röhm, who may be a familiar face to fans of Law and Order, Joy, and American Hustle. Thank you so much for joining me today, Elizabeth.
Hi, Dr. Narula. Hi, Nancy. Thank you guys so much. It's always such a pleasure to be together in this American Heart Association family. So looking forward to this very much.
Elizabeth, you yourself lost two of the most important people in your life to heart disease. Tell us a little bit about how that led you to become such a great supporter of the American Heart Association and Go Red for Women.
Well, thank you so much for that introduction. It's always almost like coming home to family, being together with the American Heart Association and Go Red for Women, because both my mother and my aunt died 2 years apart from massive heart attacks. And unfortunately, they were far too young to have had that happen. But again, much to Nancy's point, women are so grossly underrepresented when it comes to clinical trials and research that our treatment of women versus men in heart disease is so, it's contradictory in a sense. We don't really know how to handle the women in our lives and heart disease as a whole. So I did lose two important women in my life, and I've become a great advocate for CPR and Go Red for Women because I want women to be represented in the conversation about heart disease. As we know, 1 in every 3 women will die from heart disease, and so that's a big part of our work.
That's spot on, and thank you so much for all of the dedication and amazing work that you do. You know, throughout the years during American Heart Month, you've helped the American Heart Association encourage women to take care of their heart health by being active, by eating right, by minimizing stress. Considering how the world around us has changed so dramatically this past year, how have you in particular coped with stress during this difficult time? And what's your advice to women who may be watching right now and also having a difficult time?
Well, I think we're the great nurturers of our world, you know, so we have to remember to do self-care. I think one of the great things that happened during this pandemic, or at least I hope it is that we learn to give ourselves the time to care for ourselves and to de-stress, to read a book or to take a long walk or to rest or to hang out with a friend, even if it's via Zoom during this incredible time that we're all going through. But to take care of ourselves, because stress can affect us so deeply. And I think most of us, because we're the caregivers and we're maybe now even the providers or what have you, we're wearing a lot of hats and caring for a lot of people. And we do tend to take care of our health last. And that is definitely the case of both my mom and my aunt. They really let themselves go. And in the end, it was a big part of what took their lives.
I think that's such an important point, particularly now during the pandemic. Women are wearing so many hats, and we see them at home taking care of their kids in terms of homeschooling, many of them not working as they were before. So there's been a lot of shifts, and I think that focus on prioritization is so important. You know, here at the AHA, we believe that really when women come together, there's nothing we cannot achieve. And coming together to help advance science that truly helps women specifically is no different. Why do you think that more women don't participate in research? And what do you think we could do to change that?
I think, much like Nancy said, knowledge is power, and we have to become our own health advocates. I don't think most women know that 1 in 3 women will die of a heart attack and have heart disease. So Go Red for Women is a movement to educate women, to create more awareness. But Research Goes Red is the great thing we are doing now, and it's a partnership between the American Heart Association and Verily's Project Baseline. So I really want to encourage women to go to this new and exciting platform, the biggest ever, to engage and to get knowledge about their heart health. They can go to projectbaseline.com to learn more about that. But this is really, I think, one of our greatest innovations to give women this knowledge and this power about their health.
Well, we want to get to know you a little bit better, Elizabeth. So as part of these heart-to-heart sessions, we like to fire off a series of fun questions. So I'm going to start off with a question that's probably hard for me to answer, but dark chocolate or red wine, two of my favorites.
That's definitely a tough one. I will say red wine.
Yes, yes. My daughter actually said to me last night, my 8-year-old, Mommy, did you really not drink wine for the whole time you were pregnant with me? And I thought, oh boy, I guess she sees me drinking my glass of red wine every night. So
Well, it's good to be in the presence of a doctor to know that I'm in good company.
yes. So a lot of us have been home. We've taken up lots of hobbies during quarantine. Did you take up a specific quarantine hobby? And if so, what was it?
I just gave myself the permission, like you said, like we were talking about earlier, to just do more self-care, to really have time to reflect and be quiet with myself and get more rest. And because of that, I started to write my next book. So that's been my hobby for the pandemic.
That's a good one. So my husband and I love to watch some good Netflix, and we found ourselves finding some new series over the past several months. Cobra Kai, Ozarks. What is the best thing that you've been binge watched over the last few months?
I have to say Ozarks was a really good choice, but for me, it was probably Queen's Gambit or The Crown. So I caught up with those. And I also loved Normal People. I thought that was a great show.
Oh, I'll have to write that one down. So it's confession time now. We talked about hobbies, dark chocolate, red wine, but what has been your quarantine guilty pleasure?
I don't know if it's a guilty pleasure, but perhaps I didn't give myself the time to cook as much. I mean, I cooked a lot for my daughter, but I kind of pulled out all the recipes I wanted to make and that I didn't really have the time to make. And because of that, I started to just cook more in the house. But, with heart health in mind, like roasted chickens and, things that were low fat and clean and good for the heart.
Those are all good. So a lot of us have talked about the toll that the pandemic has taken on mental health, both for adults and for children. What are you doing to stay mentally strong during these times?
Well, I think deep communication and having a strong network of women, having a strong network of people that you can talk to. I think loneliness and isolation, and as we're talking about heart disease, a lack of information or a lack of a network to connect to. So what I feel I've done is created more conversation between colleagues, friends, my community, just so that, I can express how I'm feeling about the uncertainty of this time, or even what it's like to be a woman and evolve and to age. As Nancy said, there's some, biological aspects to even our aging that will be contributors perhaps to heart disease. Although I know we're going to talk a little bit also about the younger generation and how much we really have to commit to educating them about heart disease.
Yes, I know. So in my house, meditation has been our quarantine hobby, and also a way that we've stayed sane during the pandemic. So I encourage everyone to find some of the wonderful apps that are online that can help with that too. It's so easy now. In addition to some of the things we've talked about, what's one thing that you've bought in the last year, specifically because you were staying at home more?
Well, in the spirit of cooking, I started to make like low gluten-free and sugar-free apple pies. So I bought finally a glass pie dish, and that's been something fun that my daughter Easton and I have done together.
What is your most overused emoji right now? I'm sure you've been texting a lot. I don't know if you use emojis, but
it's probably the emoji that's like, looks hysterical, like it's crying and laughing at the same time. That would probably be how I've been feeling lately.
So there's been a lot on social media, some things that have been difficult to see over the last several months and some things that have been humorous. For me, it was the cat video of the lawyer presenting his case, but he looked like a cat on Zoom. I don't know if you saw that one, but what is the last thing that you saw on social media that literally made you laugh out loud?
Bernie Sanders in all of his appearances. Did you see that? He was in everybody's social media with his mittens and his, that was
Amy Schumer's delivery. I think she posted one picture.
I almost was going to make an Amy Schumer comment. Yes.
So did you set any 2021 New Year's resolutions? We're obviously about 2 months in. And if so, how's it going? And what was it?
Well, hopefully to carry with us, to stay on point with, how to treat ourselves, to be gentle with myself, we have to give ourselves permission to care for ourselves. And one of those things I hate to keep driving it back, but loving women the way I do, having lost women in my life and knowing the stress that I'm under being a mom and also a working mom, you know, we have to give ourselves the permission to just, like you said, meditate, take time, educate ourselves and immerse ourselves in relationships with each other because we're advocating for each other. So being gentle with myself to have the, you know, as stress-free of a life as I can have.
It's wonderful. And so, in all of the volunteer work you've done, I just want to wrap up by asking you, is there an all-time favorite moment that you've had in volunteering with the AHA and the Go Red movement?
Well, doing the red dress events in New York and walking the runway on behalf of Go Red for Women is the most glamorous, life-affirming experience you could ever have. I was terrified I had to walk behind Christy Brinkley in my first runway experience. So that felt very overwhelming, but also iconic and memorable. But the other one I just want to say is teaching CPR to people to the music Staying Alive, because both my mom and my aunt had heart attacks at home and neither my stepfather or my uncle were capable of performing CPR. So I'm a tremendous advocate for CPR. But those are both great moments with the American Heart Association.
Wonderful. Thank you so much for those honest answers and for.
But wait, now it's my turn to ask you. I have to ask you, what has been your favorite and most memorable moment with the American Heart Association?
So I've definitely done a lot with the AHA, but I have to say the one that stood out for me was in 2018 when I was asked to be the keynote speaker for the inaugural Go Red STEM event here in New York City, where basically the AHA brought together 100 high school girls, and they had a full day where they were mentored, where they learned about heart healthy living, and really encouraged to pursue careers in STEM. And as somebody who is a mom to 2 young girls, I think it's really important to grow a future generation of women who want to pursue careers in STEM, but also who understand what it means to set those healthy habits, particularly at a time when they're ready to, or just before they're ready to go off to college and start making choices for themselves. So that was probably my most memorable event.
Well, I'm actually glad you brought that up because one of the things I learned this year is that our younger generation and our diverse generations are the least aware about heart disease and how it will impact them. And we started with a video that really discussed that. So what is one action you would suggest to women of a younger generation of this sort of diverse young group that we're talking about to improve and protect their own health and how to become more knowledgeable about heart disease?
Well, I think it's really 2 words. It's awareness and prioritization. And you talked about both of those. And I think it's awareness of, you know, what the risk is and the fact that this is a woman's leading health threat. And I think for many women, they really just don't know that. And so you can't fight something that you don't even understand. The second is really awareness of symptoms. I just got a call yesterday from a colleague of mine who's a vascular surgeon who had chest discomfort and knew enough to go get an EKG, to go to the emergency room, where he had a VFib arrest and was coded and taken to the cath lab. And so here's somebody who's a doctor who knew to at least listen to his body and prioritize. And I think that's really what we want to educate women, is not to blow off any symptoms, but to really pay attention to their body and to make their health, as you said so clearly, a priority.
So basically all of us should join this new platform, Research Goes Red, so we can become advocates for our own personal health.
Exactly.
I got it. Okay, thank you.
This was really fun. And thank you again so much for joining with us today. But before we go, what is one message about heart disease, Elizabeth, that you want to say to women?
I just feel, you know, we are underrepresented when it comes to medical research and information, and we have to be our own advocates. So knowledge is power. Become your own health advocate. Take care of yourselves. There are a lot of people who love you and who are counting on you to live a long, healthy heart life.
Thank you again. And as my Heart to Heart with Elizabeth shows, cardiovascular disease affects all of us. So join me now as we hear more from real women whose lives have been impacted by heart disease.
My story begins back in 1998 when I was just 22 years old. I was a college student working, and I was going to school, and I kept having chest pains and arm pains. So I went to the emergency room and I got checked out. He turned to me, he said, "I'm sorry, Miss Acosta, I have some news to tell you. Your heart is very sick. You have cardiomyopathy, we believe. You're in congestive heart failure. We need to admit you to cardiac intensive care right now." So I was referred to a physician, and then I was referred to a clinical trial. And it was very interesting because they didn't have any other African American women, especially under the age of 25. So as a advocate for heart health, I always share with people that being enrolled in a clinical trial as a minority, as a woman, is so important. And not only did it save my life, it gave the researchers the data that it made a significant impact on the lives of many other people. So when they told me that I actually needed to have a heart transplant, I didn't want to believe it. I just didn't even think that it was going to come to that. I'm so grateful that I did. I took the chance because I'm on the other side now and I'm able to share my story.
Monique's story is so powerful. Here is an incredible young woman talking about how when she was only 22, she experienced heart failure. But more importantly, how she knew that her role in a clinical trial not only would help her, but countless other women. Joining me as we take a closer look at the importance of engaging women in research are some very special guests. Dr. Nikayla Cook, Executive Director at the Patient-Centered Outcomes Research Institute, Dr. Jessica Mega, Chief Medical Officer at Verily, and back with us is Dr. Tara Narula, Senior Medical Correspondent for CBS News. Thank you so much for joining us today. We are very excited to have this conversation about how women can make a difference through Research Goes Red. As you've heard already today, 2 years ago, we launched this very important collaboration with Project Baseline and our wonderful partners at Verily. And we've accomplished quite a bit in this 2-year time period, including the launch of the first 2 funded studies this past year, which are currently underway. So Dr. Mega, let me start with you. You have been there from the beginning as an architect of Research Goes Red. I would love for you to tell our listeners a little bit more about what Research Goes Red is and why we created it.
Well, Nancy, it's wonderful to be here. We know that scientific research and clinical trials really over the decades haven't enrolled an adequate number of women. And additionally, we haven't done that data analysis to really understand the differences. And as a result, there are significant gaps in our knowledge about women and heart disease. And the only way to remedy this is to continue to advocate for and to promote women as they engage in research. So when we were thinking about this issue and where we were today, we thought that Research Goes Red is the perfect vehicle to achieve this vision. Our goal at the time was to create the world's most engaged and largest women's health community. And I think we've already heard wonderful champions today, including Elizabeth and others. And we also wanted to be able to bring this idea of contributing to research into someone's home so that we know people are very busy. They don't always have the time to be able to come into a clinic to engage in research. And the idea was to make this simple, make it easy, make it democratized. And so we've done that. And we also wanted researchers to be able to connect with women. And in fact, one of our earliest programs allowed women to co-design the research questions along with investigators. So it's been an amazing journey. I want to thank everyone who's been part of it and open our arms and welcome the next generation of women into this very special community.
Thank you, Dr. Mega. It has been exciting. And I think the information and the enthusiasm of women that are participating has helped so much as we design the research programs at the American Heart Association with Verily. So Dr. Cook, let me turn to you. You have dedicated your career to research and to science. Talk to us from your point of view. Why is it important to get more women involved in research through initiatives like Research Goes Red? What will that actually do to change the narrative and the trajectory of heart disease in women?
Thank you, Nancy, for that question and for having me here today. And as you've said earlier, we know that cardiovascular disease continues to be the #1 cause of death for women, and it's more likely to contribute to morbidity and mortality for Black and Latinx women and other women of color. And we've heard about the fact that clinical studies and trials, which are really the mainstay of the evidence to inform clinical practice, have not always included an adequate representation of women or women of color. And it's so important that we understand when that occurs that prevention and treatment strategies for women are then extrapolated from data that aren't necessarily inclusive of them. And so initiatives like Research Goes Red really empowers women, including women of color, to participate in research to help narrow those knowledge gaps about gender, race, and ethnicity in cardiovascular and stroke research. And many of the activities that are supported by Research Goes Red offer a way for women, both those that are healthy and not living with illness and those that may have illness, to get involved in research. Research Goes Red also is going to allow women to have their voices and experiences heard, find studies that match their interests, and access opportunities to learn about the ways to protect their heart and the heart health of their loved ones. And so it's through efforts like this that we're going to have the opportunities to imagine a way in which we can prevent heart disease in women, treat women, and innovate with the different possibilities of therapies that are going to be important for women, designed by women.
Thank you so much, Dr. Cook. And I know that this speaks directly to the type of work you do at PCORI, where the patient's voice is at the beginning, not at the end. And that's exactly what we intend to do through Research Goes Red. So Dr. Narula, let me turn to you. Since Research Goes Red launched in February 2019, tens of thousands of women have expressed interest and they've joined the initiative. When we launched, we really tapped into something by highlighting the fact that women have been so historically underrepresented in research. The response has been overwhelming. We're getting the attention of women who are literally raising their hands to participate. What role do you think physicians can play in encouraging more women to participate in research or getting involved in initiatives like Research Goes Red?
There's no question, Nancy, that physicians can have an incredibly huge impact. And I think we sometimes forget how powerful those little conversations are. We know that those simple conversations with our patients, for example, about stopping smoking can go a long way, about getting vaccinated. And that's all true as well for participating in research. It doesn't take a long time. It takes a few minutes of time to sit with the patient and explain to them that they can be in the driver's seat, that they should be in the driver's seat for what's happening. And women want to take that role on. And I think we happen to be at the perfect point in time right now with everything that's happened with the pandemic, where we're realizing that research is no longer taking place in a siloed fashion in academic institutions that you can't access, where you're sitting back and waiting to see the results that you hear on the news. No, in fact, those walls are really being broken down. And patients need to understand the research. They need to participate in the research. They are going to be drivers of it. Science has really changed, I think, in the last year, where people are much more knowledgeable about what a clinical trial is. And that's because of COVID. So I think we need to take advantage of this opportunity and really harness it to take time to explain to patients that this is their window to understand more, to change what's going to happen to them in the future, and to help the women around them. And as you said, it's so easy with the online platform. So there's no reason that more and more women shouldn't be raising their hand. And I think they will as we begin to explain to them how simple this is and how important this is.
Wonderful. Thank you, Dr. Narula. And really, back to you, Dr. Mega. When Verily created the platform, Project Baseline, it really was this vision of capitalizing on individuals, as you said earlier, not having to go someplace to be part of research, but rather to be able to do it in the comfort of their own home. And all of our colleagues at Verily have had this vision that we could make advances more quickly if we could have participants drive research more directly. So with that, when we think about women and heart disease and Research Goes Red, what do you think some of the biggest advances in women's health might be if more women participated in research?
I think there is such an opportunity to advance two major concepts. One is what actually drives heart disease in women. And as we heard the stories today, women have their own experience, and this gives us a sense of the causes, what we call the pathobiology of heart disease. So a huge amount of opportunity there. The second piece is if you think about any medicine or a device or digital tool or even a new care pathway, the only way that we get that to patients and to clinicians is by having the right evidence. And so if we accelerate this and have women raising their hands and being part of the solution, we'll do two important things. One is we'll start to understand if some of these options have side effects that may be only experienced in women. I think importantly, we'll also start to figure out what treatments are going to be best for women. And so this type of effort with Research Goes Red will accelerate both of these things. And that's what we're tremendously excited about. So again, thank the women for being part of this and for the women who continue to join, because it's only in that way that we will understand the disease and we'll understand the treatments.
So well said. And as a matter of fact, in the spirit of understanding, Research Goes Red just launched a new survey on the platform, Experiences and Perceptions in Healthcare. And the goal of the survey is to get insights from women as to how they feel their gender, as well as their race or ethnicity, has impacted the care that they receive. Dr. Cook, maybe back to you. Why is it so important that we continue to gain these insights and drive conversations and actions around inequities in care? Oop, and I think you're on mute, Dr. Cook.
Inequities in care are so important for us to pay attention to, because while we've made remarkable progress with declines and deaths from cardiovascular disease over the last several decades, and we've even had advances in the prevention and treatment options for patients with heart disease, but not all populations have really benefited equally. And we know that health disparities are pervasive, even today, with greater than 20 percentage point difference in death rates from heart disease between Blacks and whites as of the latest data in this country. And certain populations just continue to demonstrate a significant burden of cardiovascular risk factors. For example, almost half of African Americans have hypertension. So disparities are really a multifactorial and multifaceted problem, and they're driven by a confluence of different contributors, such as patient factors that may be related to where one lives, or income or education or other types of socioeconomic factors, health system factors such as access to care, or even provider factors such as implicit or unconscious bias that emerges in the healthcare system. So unfortunately, neither the research enterprise nor our systems for care delivery are immune to these deeply embedded systemic issues, and things such as discrimination, whether it be implicit or explicit. And we know that these issues contribute to inequities in care and health overall. And so there are opportunities like this survey that you mentioned that ground research in the lived experiences of women from diverse backgrounds. And that's key to overcoming these systemic challenges. It's going to help us better understand the root causes of health inequity from the lens of those that are most affected, and help identify those research questions and answers that are going to be most useful and relevant to our healthcare decisions.
So well said, and it's so important that that we address these issues of inequities. And one place that we have seen inequities come through loud and clear is with COVID-19. And Dr. Narula, I'd love to direct this question to you. You have been covering for us and helping keep the American public informed in your role on one of the biggest public health crises of our time. And research continues to show that COVID-19 has had a disproportionate impact on individuals living with cardiovascular disease and individuals that are most likely to be disadvantaged. So could you help us with what you have observed? What is your biggest learning or your aha moment during this time?
Well, there have been a lot of aha moments for sure. I think first and foremost, it's this concept that everything is tied together, and that risk factors for cardiovascular disease increase the risk of severity when it comes to COVID, that COVID itself can impact the heart in terms of causing myocarditis or clotting. So, it's the it's the education to the American public that you can't separate out anymore infectious disease and cardiovascular disease, that everything really is tied together. And the more well-controlled all of your risk factors are, the better you're going to do. And that we have to look at people as a whole entity and not really as these separate systems anymore. I think the second big thing is about the power of public health communication and messaging. We've seen a lot with misinformation. That's come up over and over again, particularly when it comes to the vaccine, particularly when it comes to communities of color. And we have to reach people, as we've talked about, where they are in a way and with messaging that resonates with them. It's so critically important. I think the third thing, and I've heard it in my office from patients, is that the pandemic has made it hard for people to do the things that they need to continue to do, like exercising and staying healthy and paying attention to those symptoms. We've seen a decline in people going to the hospital if they have chest pain or concerning symptoms, and we need to change that. So just because we're living through this difficult time does not mean that we forget about cardiovascular disease. And then I think lastly is just the incredible power that research has to save us. When we look at the fact that we're able to create 2 vaccines in 9 months, it's because we had the platform, we had the mRNA technology from research. And we were able to move at a lightning pace. We need to be ahead of what's coming next. And it all comes back to research. That is what is going to carry us to the next step. That's what's going to save lives. And we've seen it this year, and it's the same with cardiovascular disease.
Thank you, Dr. Narula. You have seen a lot and reported on a lot, and we all thank you so much for that. As we've been having this conversation, we've received some really great questions from the audience. So I'm going to turn to those now. And Dr. Narula, back to you for this question. What advice do you have for someone who might not be able to access their family history? Is there some other thing we could be doing to reduce our risks if we're missing that important piece of information?
Well, I'm really glad that this individual brought up family history, because there's no question that we don't talk about that enough. And it is important to ask about your family history. But certainly if you don't have access to that, the amazing thing, and this is what we try to educate about, is that 80% of cardiovascular disease is preventable by all of these things that are in somebody's control. Exercise, diet, knowing your numbers, blood pressure, BMI, blood sugar, cholesterol, managing stress and mental health. There is so much power that people have just by looking at the lifestyle they're leading and by sitting down with a doctor, and this is a big one, to discuss their risk. We talk about a lot as young women that we get our pap smears, we get our mammograms. When do we ever talk about sitting down with our doctor and knowing what our 10-year risk is of having a heart attack or stroke? That needs to become just as much a part of the conversation with women, just as much in the forefront of their mind as it is to go and get their mammogram and their pap smear.
Thank you, Dr. Narula. Dr. Cook, I'm going to give you this next question. How can participating in research really change the healthcare system? Does my voice really matter?
Absolutely, yes. Your participation in research is essential, and it helps ensure that the research answers the questions that are most useful and relevant to you and other patients' health-related decisions. So in turn, having evidence-based research findings can help support informed discussions and decision-makings between patients and their physician, as Dr. Narula was mentioning, as well as those who care for them. And we envision a day when research and healthcare are more integrated, and research can take on the types of questions that are important to patients and the healthcare community, and leverage the technology and data advances that we're just experiencing all around us in ways that can facilitate meaningful results to people like you and to patients, and more rapid uptake into clinical practice. And in fact, this is one way that we can create what's called learning health systems and learning healthcare that's continually responsive to the outcomes that you desire, as well as incorporating the learning from our research findings. So your participation in research is just integral and critical to making that happen.
Thank you. And Dr. Mega, I have a two-part question for you. Do participants in Research Goes Red actually get to see the results of what we've participated in? And the second part to the question, technology is advancing so quickly. Will all research be digital or virtual in the future?
So on the first question, I'm so happy to say that absolutely. The idea of bringing results and value back to the women has been core to the community from the beginning. So one of our primary goals with Research Goes Red is to ensure not only that the participants and members of the community see results from surveys or the studies that you've heard about, but even the communities broadly, the communities that we live, have access to this information, because the information can be applied, as we heard already today, to everyday life. We know that people are making health decisions, not just when they come to see us in the office, but really every single day. It also provides information to think about new ways of understanding and treating women with heart disease. So we're thrilled that we're able to bring these results back to the participants. Now, regarding technology, I think of technology as a tool that we use to help patients and we improve clinical outcomes. So if you think about it, many hundreds of years ago, the stethoscope was considered a new technology, but it allowed us to listen to patients' hearts, or ultrasounds or CAT scans or MRIs allow us to better understand what's going on at the functional level of the heart. And we use these technologies. And I think the same is going to be true for clinical research. It's going to allow people to participate in evidence generation and in research from their homes, but there's still going to be a role certainly for more traditional sites, connecting clinicians with their patients. So I just see it as a way, a tool, something to enable this acceleration of research. And we are on an amazing journey here with the American Heart Association as we think about Research Goes Red and thinking the next generation of tools that would accelerate our work. So it's been quite a journey, and I think it's just going to be an accelerant.
Yes. Quite a journey is a wonderful way to sum up our conversation today, and the journey can be so much stronger with more voices and more participants. So before we close, I want to thank everyone who tuned in today, and thank you for taking the first step in helping us find knowledge through science to help more women live longer, healthier lives. We really need your voice and your participation in Research Goes Red. You have the power to make an incredible difference. I'd also like to extend a very special thank you to the amazing Dr. Cook, Dr. Narula, Dr. Mega, and Elizabeth Röhm. They are incredible. They are each an incredible force within the American Heart Association. Their voice really matters, and we loved hearing from them today, their personal perspectives. Please be on the lookout for more information about Research Goes Red and ways that you can get involved at the end of this program. Thank you again, and be well.